So I really always try to kind of think of everything that I can that can help this patient and just kind of have a sort of a wraparound program. And so we have, Nutrafol, so we use good quality evidence-based nutraceuticals, and then shampoos, conditioners, and then the exosomes and some take-home serums and transplants, and basically everything that I can for anybody who's losing hair, whatever level they're at. So if they're just thinning a little bit, or pretty extensive thinning, or completely bald in some areas. And so we can make a program that is tailored to them based on that.
Aloha and welcome to Energize Your Way interview series. First for our interviews is Dr. Scott Sanderson, the owner and founder of Thrive Med Spa, right here in Honolulu. We were in one of his offices, so I apologize about the lighting, but it's the information that we want to get to you. It's the value we want to add. They do so many things there, but we picked a couple of subjects to talk about, and I'm hoping that you will find great value in that. And let us know. We want to hear from you so that we can show up for you and make sure that we're creating content that has a value and answers your burning questions.
I'm excited to be back with Dr. Sanderson again. We have our second topic. The truth is we could have hundreds of topics, but we've got to keep it down into a frame. And one of the things that I'm really impressed with that you're currently doing, and I know even for myself, it has changed for me, whether I like it or not, is your hair restoration program. Tell us, what technology you're using. Educate us, because I definitely am interested in this education.
It changes for most people. It's for me as well. People look at me now and they say, oh, you have a great thick head of hair. It used to be just completely unmanageable. I use the things that we use here on myself. Over the years, a lot of my patients have had the issues with hair loss. My hormone patients were complaining about it, my weight loss patients complaining about it, my other cosmetic patients. And so I started doing some things maybe in 2015, like PRP injections, and those were nice, and those work okay. We take your growth factors, we concentrate those, we inject them into the scalp, and we can get some hair growth that way. And then there's medications that we can use, but I wanted something for those patients who just weren't responding to that, or who were just not getting good results. And so we went in further and started doing more hair transplantation. And so for those patients who aren't candidates for the PRP injections, if you're just completely bald in one area, for whatever reason it is, it could be male pattern baldness, female pattern baldness, really, really thin in an area, or alopecia areata, where they've lost it in one patch, or they had an accident when they were younger and they're just missing hair in one area. Those things that can all be fixed. And so I can take hair from one area of the head, usually the back of the head, and transplant it into those areas. So that gave me a way to be able to help the people who have much more extensive hair loss. And then we started to add in some other things. There's some new cutting edge technologies with exosomes. So exosomes are like cell signaling molecules. And you'll hear a lot about exosomes out there, like exosomes in this and this and this and this, and people just throwing them at everything. It's kind of a very vogue thing right now. But there's cell signaling molecules that they have to send a specific signal. It's like me saying words. It's only a signal if it's specific words and things like that. So the company that we worked with developed exosomes that are specific to hair growth pathways. Whatever the reason is you're losing hair, the kind of common final pathway is turning off the Wnt pathway. It's a WNT pathway, and it is essential for growth. You don't want to turn it on all over the body. Like if you had some small cancers unbeknownst to you, you wouldn't want that to start growing. That's why the oral Wnt pathway activators are struggling to come out of clinical trials because of things like that. But we can apply them topically. These exosomes are specific to activate that. So they're an exosome that really just does that. So it can help with the female pattern baldness, the male pattern baldness, the alopecia areata, some of the scarring alopecias. All of these different things, we can regrow hair with these exosomes. And it's amazing. So we combine those with the hair transplants as well. So any one of my hair transplants, if patients come in, I always use the exosomes on them as well. And so it's kind of like with my weight loss program and some of our other programs. I really always try to kind of think of everything that I can that can help this patient and just kind of have a sort of a wraparound program. And so we have, Nutrafol, so we use good quality evidence-based nutraceuticals, and then shampoos, conditioners, and then the exosomes and some take-home serums and transplants, and basically everything that I can for anybody who's losing hair, whatever level they're at. So if they're just thinning a little bit, or pretty extensive thinning, or completely bald in some areas. And so we can make a program that is tailored to them based on that. And some people, they're just like, they want to do everything.
Yeah.
Like, I want to do it all. I want this and this and this and this. And the other people they're like, give me that 20% that's going to give me 80% of my results. I want to do the one big thing and I want to be done. I don't want to put stuff on my head at home. I don't want to take vitamins or supplements, So we cater to that as well.
Right, right.
So we can make an individualized program that can help people at any point in their level of hair loss.
That's amazing. Yeah, I know that just even the aging process, and I'm sure it's because of those pathways, the hair thins. I used to think as a teenager that my hair was thin. No, now in my 50s, this is thin hair, right? That was actually luxurious.
Perspective, right?
It was right. It was just less than my girlfriend's. So in regards to the timing of those things, since again you're customizing. I mean, you're bringing that client in. When they do, let's say, the pull out the big guns and they want it all, they're fine to do the serums, the shampoos, the supplementation, that they're taking and all of that. What does that look like in time? Is it 6 months, a year, and not holding anything, just kind of an idea of the investment, time that people will be making as well?
Yeah, and it always varies a little bit by patient, their age, their health. Obviously being healthy is the best thing you can do for your hair growth. Just like all of your body functions are all going to do better, and your body will triage things too, like if you have slightly low iron levels. This is why I do lab testing in most of the female patients who come to me. If you have just a little bit low iron levels, your body will say, we need red blood cells. We don't need hair. So it's going to triage to the more important thing. Same with some of your other vitamins. So I'll check vitamin D levels, vitamin B12 levels, the iron levels, thyroid. Make sure that there's not some underlying metabolic cause or contributor to hair loss. It might not be the entire cause, but it may be contributing. And so we want to fix that too, especially with our female patients. A lot of men, it can be pretty clearly that this is just due to the DHT. And then, if somebody just has a little bit of thinning, they can probably get away with just a few treatments with the exosomes. And we have an ultrasound that actually drives them into the scalp. It's completely painless. It feels like a little bit of a tapping on your scalp. It feels warm. Ultrasound's amazing. We can do a lot of different things with it depending on the energy level that we set it at, all the way from breaking up kidney stones to breaking up inflammation in tendons to this, just driving serums. And we can do it on the face with other serums, and then but on the scalp with these exosomes. And so that's like a 3-month time frame, and they should notice really good results with hair growth in about 4 to 6 months from that.
Okay.
Now with a transplant, that is going to take about a year most of the time for it to grow about 5 centimeters. But I'm seeing a lot earlier growth when we apply the exosomes.
Interesting.
So there's a major difference in how fast people are healing. So their scalps are healing really quickly on their donor sites, and then their graft sites are growing hair. I'm seeing it within the first month. I've seen people come back and already have a centimeter of growth in the first month. I didn't expect it to honestly work that well, so I just okay, this is included. I'm just putting this together. It works too well. So I do that. I did a hair transplant, and then I exosomes on the same day, and then a month later exosomes again, a month later exosomes again. Really, really happy with that. So I'm hoping that we can take that time frame and shift it from a year for full growth to more like 6 months for full growth. And that's with the transplant. That can take some time. People who have really extensive thinning, maybe they don't want to transplant, they might need 4 or 6 months of the exosomes. You think if it's just more thinning, you're going to need more treatments. Less thinning, less treatments.
Right.
And so I encourage people, come in early. Don't wait until you're just completely bald. And of course we can help you, but it just is more invasive and more time consuming, more expensive.
I think it comes back to what you said in the very beginning of our sit down, is that being proactive versus reactive, getting in front of those health issues, getting in front of that hair loss, getting in front of those. And that's so important, because most will go, yeah, it's okay. And then we run in, right? And that's just a testament to who you are, too, because you want to be ahead of it. You want to help people in advance with all of these things. So my final question to you, now I did ask you specifically about a couple of things, but if you were to pick one thing in all that you do, which you have quite a catalog of services that you provide, what is your favorite, or what is it that you have the most passion around?
I think
Might be tough. I
that's also a
know.
difficult one. It's because every patient has their thing, so it's kind of whatever is bothering that patient that's really making them feel bad in whatever way, helping them with that. Hair, honestly, it makes such a big difference. People don't quite understand how important it is to somebody until it's gone, until you're in that situation where you've lost it. It really becomes part of people's identity. And I say, especially with my female patients, they just feel devastated when their hair starts to thin so badly. A lot of men will be like, oh, well, I'm fine, I'll shave my head, who cares? Unfortunately, in our society, that's not necessarily considered to be socially acceptable for women to do that at this point. And they don't want to be forced to do that.
Right.
And it really does become like kind of part of their identity. And so to be able to help them has been really profound. And so I wish that more women knew that we have these options, because it's women are smart, and they can hide it better than guys can. You guys thinning his hair, okay? Women get real creative in the way they style their hair and do these different things. They can have pretty extensive hair loss and have it hidden pretty well, but they still know it.
Yeah.
And it still bothers them. And so if we can help them, it makes a big difference in the way they feel about themselves, their confidence, and their day-to-day life. And that's amazing. I love that.
Yeah, that's awesome. And I absolutely agree 100%. I appreciate your time. Thank you so much. I'm looking forward to sharing this information to everyone, and I couldn't agree more. Let's get proactive. You know who you are. I know who I am. I've got buckets coming out in the shower every day. I'm like, why?
Thank you so much for joining us. But remember, at the end of the day, we need to energize your way.